Hello everyone, it's Dr. Nirav Pandya. A lot of people have questions about Draymond Green's injury and what it means for him moving forward. And a lot of people particularly have questions about how a calf can be related to a back. Here we'll break down the anatomy of the back and how lower extremity injuries can be tied to the spine and what this means for an NBA player like Draymond Green. Now the first important thing to understand is with these complex injuries, it's really critical to be able to examine the patient and look at the MRI as well too. And that's where a lot of the complexity comes in. Obviously, I've not personally examined or looking at his imaging, but this is more of a general overview of what we look for in injuries like this in NBA players. Now, the first important thing to understand is when an athlete has a calf injury or has calf pain, the first thing you want to look at is that actual injured area itself. You want to see, is there structural damage to the calf? Do the joints above and below have any issues? And a lot of times what may happen is that your actual exam doesn't fit with the fact that there's actual structural damage there. An athlete may have more weakness than you expect, or may have some numbness or tingling that may suggest that it's not just a calf-related issue. So many times then we'll actually go to the back. And the reason why you look at the back is that there are a lot of different structures in the back that can actually cause lower leg pain. And a lot of that has to do with the anatomy of the back itself as well too. Now here's a model of a spine right over here. And what you'll see over here are the vertebral bodies, which are basically the bones in the back. Then you have your discs, which basically run in between the two vertebral bodies. And then if you actually rotate around, these little yellow things are the nerve roots. Now the nerve roots are important because that's what basically powers and gives sensation to the lower extremity. So if you actually look at the spine in this way over here, you can actually see a nerve root that is getting compressed or irritated by a disc. You can see a normal disc up here, but down here you see a herniated disc or a bulging disc is basically irritating the nerve root. Now what can happen when that nerve root is irritated is that that nerve will then get really activated. It can sometimes cause a weakness to the muscle that it powers in the lower extremity, or it can cause pain. So for an athlete who may present with calf pain and it doesn't necessarily fit with your physical exam that there being a primary calf issue, if you look up in the back and the disc at that level is basically compressing or bulging or irritating that nerve, then the calf, which basically is supplied by that nerve root, may get irritated. Now the important thing to understand is what the treatment for this is. Now in general, the first line treatment for someone who may have a little bit of weakness or some pain in that area is rest and physical therapy. If rest and physical therapy doesn't get this better, then you typically will sometimes go to injections, which basically help to alleviate the inflammation that that disc is causing on the nerve root. The third thing that can be done in rare cases, particularly for a higher level athlete who's having this for the first time, is do a surgery that basically relieves the compression of the disc on the nerve. The important thing to understand is that regardless of whether patients get operative treatment or non-operative treatment, if you look at one of the best papers that looks at this in NBA players, nearly 80% of players return to play. The difficult thing is determining when athletes will return to play. A lot of that has to do with the fact that how weak they are, how quickly does the pain resolve, what does the MRI actually show, and how susceptible is that disc to get irritated again. The important thing to understand is that this diagnosis has been caught. It's important to treat it properly and try to avoid surgery, and then hopefully get Draymond Green back on the court so he can contribute with the rest of the team. Thank you.